Hello everyone. I'm going to discuss one small topic from public health dentistry from statistics. This is the difference between parametric and non-parametric. Parametric has different name also, Gaussian and quantitative, and non-parametric it is qualitative. Okay, so they can change the name and ask. They will not ask about parametric. Maybe they can ask student t-test is a quantitative or qualitative test. Okay, so you should be aware of these names, these different names. Okay, so first is parametric or quantitative test. In this, first is student t-test and second one is ANOVA and z-test. So first I will tell you about z-test and student t-test. If the sample size is less than 30, then we will use student t-test, and if the sample size is more than 30, then z-test. Okay, so student t-test is again divided into paired and unpaired. It's very simple. Paired test is if you compare the same group before and after, like if you given some drug, what will be the reaction before giving the drug and after giving the drug, then you will use student t-test paired one. And if you are if you have asked to tell the difference between if they ask two different groups, if you want to know about BP in two different groups like male and female, so you can use unpaired t-test. If they asking about only same group of females before giving few drugs and then what will happen after giving that drug, then you can use pair test and unpaired test if there's totally two different groups. Okay, ANOVA test is used, it is also called as F test or F ratio. Again, the alternative names are very important. It is used when more groups are used. It's very easy if they are asking about height and weight of school children. So what is the criteria? You have to they didn't give any group, they didn't give any class section, so it is a vast test, so you will use ANOVA test. Okay, so more groups. So in non-parametric, which is a qualitative test, first is chi-square test, Wilcox test, which is signed rank, Wilcox test, which is ranked sum, then sign test. One more test is there, Mann-Whitney test. Okay, so I gone through one question. It's written that they are asking about two independent sample, which test you will use from non-parametric. So if they are telling that you have two independent sample and which test you will do in non-parametric, it is Mann-Whitney test. And if they are asking two independent sample from parametric test, then you will use student t-test. Okay, this was the one confusion. So chi-square test. Okay, chi-square test, they have given one short form, PAF. P is proportion, A is association, and third one is goodness of fit. It is proportion between two different groups. Association, what is association between different groups? And goodness of fit is like if you have done some experiment or some studies and you got particular number, so that number should fit with, when you do the chi-square test, we should get the same number. It should fit the number which we got from our experiment. Okay, this is goodness of fit. So they ask what is chi-square test. So it is an association or proportion between two variables. Okay, so usually we got confused between which test we have to use. If they are giving the values before and after, then pair test. If they have not given any before and after and they are comparing between two groups, unpaired. If it is a large groups are there, 3, 4, 5 groups are there, that ANOVA test. Okay, chi-square test, if they are asking about some proportion, some association, then you use chi-square test. Okay, one more thing is there, in Wilcox test signed rank, they are talking about paired, same thing after or before. In Wilcox test rank sum, they are talking about unpaired. Okay, and sign test, same percentage, proportion and fraction. If they are given percentage, proportion and fraction and they are asking which test is used in non-parametric, you will use sign test. I hope I was able to remove some confusions, and if something missing in this video, please inform me. Thank you.